Hi guys, Dr. Dan Nightingale here, your clinical dementia specialist. Thank you for joining us for this video. Wherever you are in the world, I hope you're having a fantastic day. I certainly am. Now, for people who follow me on Facebook and Instagram, you will know that each day there are a couple of statements that I make, a couple of quotes that I make. And so what we're doing now is taking those quotes, those statements, and kind of explaining the meaning behind them. So with this video today, I thought we'd look at this one because this is something I've been dealing with clinically as well. What I'm saying here is, the quote is, use memory aids such as calendars or notes to assist with daily tasks and routines for individuals who are living with dementia. Sometimes people end up with lots of different schedules, calendars, notes all over the place. And of course, when it comes to people who are living with a neurocognitive disorder, we need to streamline things and make it as basic and fundamental as possible so that it's easy to follow, not just for the person who is living with Alzheimer's disease or other form of neurocognitive disorder, but also for the people that are supporting them as well. So let's think about how we can do that and make it so much more straightforward and easier to follow. My suggestion is to have a whiteboard that is clear, that is concise, and that is consistent. The 3 C's: clear, concise, consistent. So I know it's difficult to maintain things like this and keep up with it, but it is absolutely imperative that we do that. So the whiteboard needs to be somewhere where the individual can see it, and it needs to be big enough, written. The writing needs to be big enough so the person can see it as well, and the times. So use a whiteboard so that you can easily erase appointments, you can easily erase stuff that's on there, you can easily write new things on there. So try and have that as a schedule throughout the day. So you can get those whiteboards that do have the times on there. So throughout the day, this is what we're doing, this is what you're doing, this is where we're going, that kind of stuff. If, which some of my patients like to have, a diary, then have a diary that, again, is big enough that things can be written in there clearly, concisely, and consistently. Those are the 3 things that are really important, the 3 C's. Be clear, be concise, and be consistent with whatever it is that you put in place to ensure that the person has something consistent, something to follow. We've always talked about a structured routine, how important it is to have a structured routine. And it is so helpful for people to have that on a whiteboard, in a calendar. Now, some people are not able to read or understand writing, understand the words. It might not make sense to them depending on the type of dementia the individual has and where they are in their journey. So you might not find that system of any use at all. It might be better, it might be easier to use flashcards and pictures so that you can evidence this is what we're doing, this is where we're going. So if we've got a doctor's appointment at 9 o'clock, you might have the picture of the doctor on the whiteboard at 9 o'clock. And then this is where we're going at 9 o'clock to see Dr. Dan or whoever you're going to see. And you can do that with the majority of appointments. So if you're going grocery shopping, you can put a picture of the grocery store. If you're going to the gym, you can put a picture of the gym. So sometimes it might be necessary to use both things. You can write it down and you can also put a picture there. Depends on the individual, depends where they are in their journey, and depends what works for them. So always think about what works for the individual best. But if you're going to put this system in place, make sure that it is done clearly every day. I go to places and I see things where there is a calendar or a schedule or a whiteboard where the system has been put in place, but it's not being used. The whiteboard, there's nothing on the whiteboard. There's nothing in the calendar. Or if there is something on the calendar, it's been changed, but it hasn't been changed on the calendar. So a date, a time, a place may have been changed, but nobody's changed it on the calendar. So bear all those things in mind. And now, as always, I am joined here by my lovely wife and practice manager, Lynn. And I think she has a question or two that she would like to ask.
Yes, I was going to comment, maybe you don't need the whole month on a calendar or whiteboard. Maybe you just need the week. You might have to adapt it to just have the day. And also there's that clock that we'll try and put a link that sits on your desktop, and it says the time digitally, and it says the date, and it tells you good morning, today is, May 29th, Wednesday. And that's very helpful too for people to be able to see that and know, because if you have the dates on a whiteboard and they don't even know what date today is, it's not very helpful.
Right. Yeah.
So you have to reinforce.
Yeah. A lot of time, it's more important to have the day than the week. Because, we want people to remain present, and we don't want people to be worrying about, on Wednesday I've got this going on or this. So it is all about being present and focusing on today. Yeah,
today, right? Because of that anticipation of, how we're saying, just to touch on that, telling someone they have a doctor's appointment next week or next month, or it's really not valuable at that moment. Relevant. And it only could create anxiety or unwanted fear.
Right. Yep. Fantastic point. Absolutely. Agree with all of that.
Yeah.
Thank you.
And is there colors on the whiteboard they should stay away from or should stick to?
It needs to be clear. So if you've got a whiteboard, use a black pen, a black marker pen. That's the best thing to use. So that's clear. And don't write everything. That's a good question, this. For people who have dementia, and especially Alzheimer's disease, writing things in all higher case letters is not a good idea. So make sure you use the right way that we would write something. So
use upper and lower case, in other words.
Always.
You don't want to look like shouting or
absolutely
it's urgent or bad.
And you can't, some people with Alzheimer's disease will have a visual issue that they can't actually see that anyway. If it's in higher case, if it's in capitals, they struggle to see that. So just your first letter being a capital and then lowercase. Yeah, absolutely.
I know you've said red is not a good color, so I just wondered, probably not a red marker.
No, red indicates danger. Red elevates people's anxiety levels. It instills anger. So stay away from red always. Whatever you're doing, do not use red. Don't wear red. Don't just avoid red. It's for things like fire engines and
stop signs
and stuff like that. Yeah.
Okay. Also, would it be a good idea to maybe post one in the bathroom, like on the bathroom mirror, a whiteboard, another one on the refrigerator, to have it in multiple locations on the nightstand or something where the person will see it in multiple places to help as a reminder, maybe on the back of the front door, something like that.
If that works for the person, absolutely. Whatever works for that individual is the thing to do. Definitely. Also, just, excuse me, on that note, if you are going to type something and put it around the house, a notice or a sign, use the font Verdana. Verdana is the best font for people who are living with dementia to see, and Verdana is the best font for them to actually read and work out what the letters are. So think about that as well. Use Verdana, use white paper, use black ink. Yep. Okay.
All right.
Cool. Well, thank you for listening. Thank you for tuning in. Please remember to share these videos with all your friends, colleagues, neighbours, anybody you know. Tell them about this YouTube channel. The more education we can get out there, the better. So share it. Have a fantastic day. Have a fantastic week. Enjoy yourself. You know where we are. Go to my website, drdanielnightingale.com. Follow me on Instagram, Facebook, YouTube. If you've got any questions, please feel free to ask them. Have a great day. And remember, guys, say it with me. Dump the soda.